Good morning, Robbie. Good morning, Wendy. How are you guys?
Hi, Kathy.
How come I have another patient, like extra patient? Are we short-staffed again?
What?
Yep, we are short-staffed again. We have no NRT or float nurses available. So that's what you're stuck with.
Oh my gosh, why do I have 3 patients on isolation plus 2 other patients? That's 5 patients, Roby.
Exactly. We're always like this.
Well, that's what you're going to be stuck with, Wendy and Kathy. What can you do? We got to do this.
I better not be working through my break again.
Well, does anybody want to take an extra shift?
No way.
There you go. That's it. Oh, hi, Ruby. How are you?
Hey, Jay, I'm good.
I want to talk to you for a sec. Do you have a few minutes? So I want to discuss something very important.
Sure, I think I have a few minutes.
Okay, let's go into my office.
Okay, sure.
Hi Robbie, the reason why I want to talk to you is about all the incident report that I received in the past few weeks regarding the fall incident, the medication errors, and also the family being complaining the staff are not answering the call bell promptly and staff are taking too long to answer the call bells. What do you think that we can do about this situation?
I mean, I think we could call a staff meeting maybe. Oh.
Hello, Roby. Dr. Patel is here and he wants you to come on the...
Okay, I'll be right there. Sorry, Jay, I gotta go. I gotta take care of something. You can deal with this yourself.
Man, I don't know what to do. Maybe I should think a different perspective. Have a staff meeting. I guess I need to talk to them first to find out what we can do as a team to solve this problem.
Look, she wants to have a staff meeting.
So weird, eh? This manager is not doing anything anyways. Why would...
What good is this gonna do?
I don't know. Maybe we should go and find out. So what do you think? Hi! Good afternoon, ladies.
Oh, hi.
Hi,
How are you?
Good.
Thank
And
you.
how are you guys doing?
Not
That's so
too bad.
nice of you.
Thanks,
Oh, yeah. Want some?
That's my pleasure.
Sure. Yeah. Okay. Thank you. Is there any burgers or no? Just no.
Maybe next time. Welcome to the meeting. Thanks for all being here today. The reason for the meeting is that I had received many complaints and concerns from the family, and also many incident reports regarding medication and false incident report. I just wanted to talk to you guys as a team, what we can do, and this is your chance to voice your complaints and concerns.
Well, my main concern here is that we're always short. We're always short staff, like almost every single week. So those patients, like we always take extra patient because of that. And nothing is happening. We always talk to the unit leader, nothing is happening. Nobody's even getting a personal support worker for us for help.
So Kathy is exactly right, Jay. We do have such a huge workload and we're just not able to effectively manage our time. Today, 3 out of my 5 patients were on isolation, and I don't think it's fair to the patients. It's a health hazard to them.
Yeah, that's right, Wendy. And one thing more, like we always get extra patient, right, when we're short, and some patients are complex, and it's not even in my work of like scope of practice, and that's not right. It's so unsafe to take those patients.
And on top of that, I noticed that my staff is not taking their break. Even I can't even take my break. And I don't know, when I go through my shift, I feel so tired and weak, and I'm hungry, and I can't take my break because it's so busy, and I noticed that with my staff too.
That's exactly the way that all of us are feeling, Jay.
Yeah.
Okay, I do understand your concerns. Can we work together as a team? I know you are short-staffed and the assignments are delegated inappropriately, and the patients are left unattended. You are not taking your break as you're supposed to take 45 minutes to 1 hour. Can we work together as a team to make this possible?
Yes,
Sure, yeah.
Okay, Roby, is there any way that you could come in and assign patient assignment accordingly based on the CNO guidelines, RPN and RN? Because we have to look at the environment, the nurse and the client, and the RPN can take stable patients where RN is supposed to be assigned unstable patients, because we can't just give it to RPNs the unstable patients, right?
Okay, maybe I can come in a little early and review all the patients. Then I could assign them accordingly, but I would like to ask my staff to let me know if the patient load is too heavy for them, and then we can assign it accordingly together.
Sure, that's a good idea. Actually, I think we tend to we really need to communicate with each other, because like for the past how many months we're like working on our own, right? So it's better to have a teamwork here and talk to each other.
Sure, we can have an in-service about teamwork, and we can learn how to work together more efficiently. I can arrange for that.
Yeah, that's a good idea, actually. Yeah.
I sure
Okay, I'll
hope
do
that
that.
helps, Jay. But I just have a quick question. What about our breaks?
You will make sure that you take your break, no matter how heavy the floor is. That you have to work among yourself. Make sure if you're going on break, the other nurse is covering you. And your first break is 30 to 30 minutes, and your lunch break would be 45 minutes. And Ruby will assign the break accordingly.
Yeah,
So that's gonna be like 3 breaks, right? We have to take.
Yeah.
Yeah. Okay. That
Sounds good.
Yeah.
We'll see how it works out, I guess.
Yeah.
Any other concerns, ladies?
Well, I guess that's it. Is there any more, you guys? I'm okay.
Okay, if you have any further questions or concerns, just please come and see me. I'll offer suggestion box and stuff in the staff room where you can just put your concerns, and I'll look into it. I cannot promise everything right away, like giving a PSW or something, but I'll look into it. That's something that I have to take into work with patient care coordinator and get back to you guys on that.
Sure, great. Yeah. Hey, Wendy, can you help me, please?
Sure, with what?
With my patient.
Sure, no problem.
I have to move her.
A transfer? Sure,
Yeah.
no problem.
So
Hey,
what's going on?
what's this here, Kathy? A staff meeting or something? Oh no.
That's
I thought-
so weird, because we just had a meeting last time.
Oh no, it's actually a pizza party. Isn't that great?
Yeah, I love pizza.
So what do you think about what our video was portraying? Do you have anything to reflect about?
Well, it's pretty good actually. I mean, we had a good video clip, I guess. And I just want to tackle about the transformational leadership, which is our main concept applied in this video clip. So, but before that, I just want to define it. What is transformational leadership is a leader that energizes and motivates the staff, right? So it's not only both are agreed upon on both goals.
And I just want to talk about the 5 evidence-based practices of transformational leadership, as I noted while we're watching the movie clip. So it's about, first principle is build relationship. So actually it's a critical leadership practice, and it provides a foundation, right? So based on the clip, when the nurse manager asked the unit leader, she already built a relationship with her, asking the issues and concerns of the staff, and then after that, she called for a staff meeting. So that's very good. And the second one is supportive environment, wherein she implemented changes. Like she actually said that she's going to have an in-service teamwork. Is that with that? Okay. And then yeah, and the other one is like she actually focused on the shortage of staff, right? So bringing PSW. The other principle that I've noted there is that it balances values and priorities, which is advocating necessary resources, which is the PSW, what else? The in-service teamwork that has been talked about individually. And the other one is lead and sustain change, which is a kind of like an approach, the participative approach, that's what they call it. And it's like the nurse manager she didn't decide it for herself. Actually, she asked suggestions and opinions from the staff. And the last one would be the empowering workplace, which is, I think you're going to say something about it.
Yeah, sure, I'll talk about it.
Okay.
So Ellison currently describe empowerment as a process of unleashing power in people, and this is including their knowledge, experience, and their motivation. A good example of empowerment is through our video when Jay was talking about how she was suggesting the in-service for us to help us learn how to work as a team. I think that in the future, maybe we could also initiate these types of work in-services where we can learn more about what we're doing in the workplace and how we can expand our knowledge and help our patients to have the most beneficial care possible. Also, staff engagement is also a critical component to a motivation increasing job satisfaction. According to Kerfoot,
Good last name, eh?
Yeah, called staff engagement, the leader needs to guide high performance and recovery times. So a good example of this is when the staff complained of no breaks. They couldn't take their breaks. So Kerfoot's just saying that we need to take our breaks to increase job satisfaction and decrease burnout, so we can perform properly and appropriately, and we're not tired during our shifts. Also, at the end of the video, we talk about how Jay provides a pizza party for us so that we could reward our accomplishments, what we did for the week, that we did something to improve our workplace. In the future, I think that we need to call on our management, our higher chain of command, and we need to try to improve the workplace as best as we can and reward people for their, for their accomplishments, and also look for areas where we can improve in the future.
Very good, Cassie. Very good, Roby. Something that I noticed in the video was there's the qualities of being a leader and also clinical excellence. So after the nurse realized that her qualities of being a leader were very, very poor, she began to make changes. And one of the positive changes that she made was being flexible. So she was going to her staff, she was asking for their opinions, she was asking for their suggestions. She even went above and beyond and created an open door policy, which was great. And so now this environment, the nurses are no longer feeling scared to go to their manager. And they're not feeling, well, if I go to my manager, I'm going to be unsupported. They now know that they can use that open door policy and go and feel supported. And also the charge nurse, she didn't realize it at the time, but she was actually creating a very, very good partnership between the management and with the staff. She was sharing knowledge with them, she was being supportive, and I guess most importantly, she was listening to her staff. And clinical excellence was something that was shown. Overall, a positive workplace was created, and as a result, the workplace became very, very fair, which you guys spoke about. It became balanced, it provided a culture of safety, and it certainly created an environment that has tolerance and respect from the nurses to the managers and the managers towards the staff.
That's great.
One thing that I like from the video is the leadership. I think all nurses, regardless of their practice setting, have opportunities to demonstrate leadership. I think in the video, as a team, we all posed leadership quality by respecting each other through communication, also shared vision, which is our focus is on a patient-centered focus, and also good communication skills. Nobody was disrespecting anyone. Everyone was listening to each other's opinion, right? And also another thing is I like how I included the CNO practice guidelines, where I was giving a suggestion to Roby to look at the nurse, client, and the environment when making the assignments, when assigning the staff for patients, right, regarding the acuity, related to the acuity. That's something I think we did. And also with the practice standard guidelines with accountability, I think we're all accountable for
Our own
actions.
yeah.
Certainly.
So, just one question. So, we're like, what's the focus of growth here for like everybody since we tackle this video, right? Like, for example, the qualities of a transformational leadership. You can't get it, like you can't have this right away. It's like a learning process, right? So we're going to that, like, you know, ladder to be, you know, at least maybe one day we can become like a transformational leader.
I think that's a very good point, Kathy. I think in the video it showed that she became a transformational leader quite quickly, but as Kathy was pointing out, it is a process and you're always going to be learning along the way. And that's the most important thing, just learning.